Our panel to come up now. And I just also want to take a minute to thank Alyssa for working so hard with us and putting this together. And what I'm going to do is actually, I'm going to ask the panelists to, I'd like you to introduce yourselves. And talk about what you do for the hospital and what you do as far as the green part of your job.
Can you hear me? Okay. Am I loud enough? No? Okay. Is this better? Hi, my name is Kathia Benitez. I'm the Energy Program Manager for NewYork-Presbyterian. I work within the Facilities Operations Department. And my role is basically to oversee all energy program initiatives throughout our hospitals, from demand response programs, from strategically procuring energy, future energy, so that we lock in a significantly low rate and reduce our energy costs in that aspect. Support the Sustainability Council by providing energy conservation tips for our employees, establishing policies, procedures for the hospital, and a number of other things. But at the moment, that is how we support the Sustainability Council within the energy program.
Thanks. Jessica, do you have anything to add about? Okay.
Hi, my name is Jonathan Kayser, and I am a member of the Psychosocial Rehabilitation Department. For those who are unaware of what that is, I actually run group therapy on the units here with some of the patients, and I'm also a green champion for two departments, one being that department, the PSR department, and as well as for 4 North units that I work on.
My name is Adam Bartlett. My primary function here is the project manager for construction and maintenance projects. As you're on your way around, you see we got a lot going on, a lot of scaffolding going on, so that is my primary function. My green function is as the green captain of this campus, so I'm kind of a go-between between the Sustainability Council and people like John, of which we have a couple of dozen on the campus that run their individual green programs on a unit level, so I coordinate between those two levels.
Great. So I'm going to start the questions, but I just have to say that, I mean, you are really an inspiration to me. My company is Green Team Spirit, and you guys clearly have that, and I'm going to learn a lot from you, which is very exciting. So, as Jessica just described, the New York Presbyterian Hospital Sustainability Council sets goals across key areas where there is opportunity to reduce waste, conserve energy, and minimize the organization's overall environmental footprint. So, can you tell us what tools have been used by the hospital specifically to measure and monitor progress across the organization in these areas? And this is probably for Kat, would you recommend to this group the use of the EPA's portfolio manager to other audience members here today?
So currently we benchmark and monitor energy consumption, water consumption, and greenhouse gas emissions through the EPA Energy Star Portfolio Manager tool. It's a very resourceful tool. It's free. It's nationally well-known, and if you want to establish a baseline, that's a good resource to use for starters. And it'll help you establish a benchmark. So how is your building performing against buildings with your type, similar type building structure, sorry. We also we started using Watermark. It was a healthcare water benchmarking tool established by Mileti, an engineering firm that is supporting ASHI's mission to support the sustainability roadmap for healthcare. And so I welcome all of you to use this tool. It's free. They're both free. We just started using Watermark, and we realized that we were the first behavioral health hospital using the tool, so we don't really have a baseline. We don't have a benchmark at the moment because no one else of our facility tech is using the tool. But we hope that they expand it so that we know how we're performing against other behavioral health facilities.
Great, because I'm sure water intensity around here is a very, very big deal across the hospital system, as it could be for many of your businesses as well. So let's turn to communications. So internal communication and outreach are vital to achieving a culture of sustainability, and I think it's, really interesting to see that you've got, movement at the top on sustainability all the way down to the floors and to roles like Jonathan. So, what strategies have worked or what strategies have not worked to increase awareness about the importance of sustainability? And Jessica, you want to take that?
Yeah, I can start that one, and then I think that some of my fellow panelists may be able to localize it. But, we've taken a broad look at communication, and I think we're always looking to improve it. We do have the InfoNet and our external website, but I think what we found is that the more we're able to localize the communication, the better. So we start broad, and by creating a green team and identifying green champions that can communicate locally, that's been really effective. What we do to keep sustainability sort of front of mind week to week is that we develop a green tip that has to do with any one of our topics or key areas within sustainability, whether it's reducing regulated medical waste, reducing energy usage, giving tips about what people can do very simply, but also what kind of impact they can have by doing those things. We send those out in PowerPoint each week. So Adam, for example, would receive that and share that. But another neat thing, and Adam, maybe you want to speak about how you sort of grab the reins on this at Westchester, because it's become, he has a bit of a following now, and people at our Friday, Patient Safety Friday Forum, which is an education forum for managers, are always very excited to hear from Adam every week. So I'm going to pass it to Adam to maybe speak about, what that's like here, because I think it really embodies the spirit and the contagious energy that we use to spread the message.
Thanks, Jess. As you can see, there's different tiers. There's the corporate tier, we go down to the campus tier, where I am, and then obviously below that you have the individual department tiers. For those of you who know me, I have a bit of a personality. I think most people enjoy it. But like you said, Patient Safety Fridays, we have a forum where all the leadership is there, so it kind of is a captive audience, where I take the corporate, if you will, green tip. Sometimes I tweak it, sometimes I add to it, sometimes I go completely rogue, as I like to call it. Sometimes I find something in my readings or one of my green champions passes something along me that week that I think is very relevant to Westchester. And oftentimes, as we are behavioral health here at Westchester, sometimes the corporate green tips are very clinical, related and aren't really very applicable up here. So I kind of balance that to make sure that it's relevant. I add my own kind of twist. I try to make people laugh and make it fun, because ultimately, if you make something very onerous and very statistical driven and very boring, it's not going to get through. So I try to make people, if I get people to laugh along with my presentation, it means they're listening. And if they're listening, they're much more likely to take that information back to their individual departments. And of course, that's also followed up, that's a physical presentation, it's followed up with an email to my green team, which I also kind of twist and I make it my own. And then the green champions of the departments take that and do what they will with it, because every department obviously has different focuses, different things they can and cannot do. So I always encourage them to not just take what I email them forward to their teams, but rather customize it to their individual departments, which may have different approaches. And John is one of the people who want to email it to, so maybe he can speak
John, that would be great
how he does it.
Took it down to the next level.
So I think that it's kind of drawing back to what we had discussed very early on, is thinking about what do people really drive at, or what's driving their initiative. We have all these really great things that we put out there in the green messages, but probably trying to relate it to each employee is one of the most important things that I try to find. So just for one example, you see that Adam here has a green cup, for example. So most people get their cup of coffee in the morning. We have incentives behind that too. If you bring your cup in the morning, it's actually cheaper to use your cup that you continue to bring every day while decreasing the amount of, plastic or paper cups that they have to throw in the trash. People feel good about something they're doing, but it's also something that is an incentive for them. So I try to find what I can reach people on their own level, so they don't feel like they're going so far out of their way. It's those types of things. I communicate with people, whether it's the face-to-face or I send them as well, like he said, emails along the way, and I try to tweak it to find what's specific to them how is it going to impact their lives or their community, whether it's here at work or at home. I think that that's probably the most important thing about my job, to drive home that education, to kind of motivate people to do the right thing as we see, and to make them feel good about what they're doing as well, while making it easier.
That's great. So, switching topics to transportation. I know that unlike New York City, where employees can easily take the subway or another form of public transportation, that this facility's suburban location presents certain transportation challenges. Hi, Doug. Would you like to talk about that? You would like to know what are some of the strategies that you put in place to increase carpooling and reduce transportation travel by employees in general?
Best to stay off this panel. So we here at Westchester have a fleet of vehicles that actually do daily transportation trips to our East 68th Street campus. So every day in the morning, down we send a 24-passenger shuttle, and in the evening we return the shuttle to a round trip. So that's 24 passengers each way. The bus is usually full. We're transporting residents, diet interns, research staff, so that in itself just takes all those vehicles off the road. We also have a 21-passenger bus, you may have seen it in White Plains, that we go 5 trips daily into White Plains. We go to the bus depot, we go to the White Plains train station. So we provide transportation from the train station, bus depot, back here to the hospital. Again, that bus on the morning and mid-afternoon run is full. Patients also use, the outpatient program also uses that program for transportation to the programs here. So we have a lot of activity and transportation expertise in how to get vehicles off the road. And you'll see out front, if you enter this morning, we have an electronic vehicle. We have 4 GEM cars. Those vehicles are used by our shops here at our campus. We have, respectively, a carpenter, electric, a plumbing, a paint shop. And you see the campus. It's 214 acres, for those of you who are wondering how large this campus is. So, and 50-some-odd buildings. These vehicles are used by the shops daily to transport materials to and from the work site in lieu of using a pickup truck or a van that was the alternative. So we have measures in place, and as we said, the 501 rideshare, we are also partners with them, offer that opportunity to all our staff. Not sure of the data behind that, but opportunities exist here at this campus to reduce the amount of transportation and vehicles on the road daily.
Thank you so much. And Doug is the, what is your title exactly? Head of General Services and Director of General Services, is that correct? Doug McGrath, so we appreciate it.
He's in charge of pretty much everything.
He runs the place, bottom line, that's really all we have to say. And then just quickly, do you guys take advantage of any video conferencing? Because you probably are flying out and going to conferences, but do you also do?
Yeah, we try to use video conferencing, webinars, teleconferencing, any kind of electronic meeting that we can. We try to utilize, especially because we're isolated up here, so to speak, from all the 4 campuses. Well, it might be very easy for people down there to shoot across the street for an hour meeting, so that now it's 10-minute walk plus an hour meeting. For us to go down there, it's really it's half our day's gone.
Right.
So we really try to avoid the amount of times from this campus we have to go down there as much as possible. That's really critical that we put our face there, because it's a huge time waster, and obviously it's a waste of the transportation, getting down there. And just more efficient all around, environmentally and personally.
And one thing I would add just to the alternative transportation piece is that as any staff that work at NewYork-Presbyterian have transportation benefits available to them, so they can remove money, pre-tax, out of their paycheck to pay for metro, MTA, etc. And the other thing we also encourage is bike riding. We encourage biking to work. It's a little easier to do at some of the city. However, that doesn't stop many staff at Westchester, including Adam, who on Bike to Work Day cycled how many miles?
43.
Wow.
I live in Dutchess County.
Oh my goodness.
So, many, and that was really an awareness piece, teamed up with a couple of others.
Clearly, not just on a regular basis.
Where possible, we do provide bike racks and do encourage that as an alternate transportation method as well.
That's great. That's great. So talking about energy, so reducing energy consumption is a key component of any sustainability program. So have you created a list of your business appliances and equipment, reported whether or not they're Energy Star rated, or made a plan to replace items as you go along with more efficient ones? Kathia, take that.
Sure, I'll answer that. So last year we rolled out an energy policy that was not specific. It did not have specific guidelines, or it didn't provide our procurement department with a specific guide on what we should procure. So what we've done this year, we've revamped the policy and added strategic language that states that we would only procure Energy Star rated equipment. And we have provided them with lists of products that departments can choose from. They need a new microwave for their pantry or something, or they need a new computer. And we do keep inventories, and Adam, I know you wanted to talk about the inventory list that we have, but we do have them, not to detail, we don't, but it's in our policy to do so.
And then I wanted to ask you about alternative energy. You guys explored solar, maybe geothermal, what's possible here?
So we know geothermal is possible. We finished a thorough engineering study in 2010. We had received a significant large grant from NYSERDA to roll out the project through the ERA grant. But unfortunately, the payback period was not favorable for the organization. It was over 18 years. And so obviously that's something the organization did not want to invest in. So we opted for other low-cost measures to implement, fixing our steam traps, lighting retrofits, occupancy motion sensor installations, and a gamut of other things. But right now so we had to close that project. But we will look into it, I'm sure, in the future, just to see what else we could do, whether other, reduce the type of geothermal equipment that we want to install. The one that we have proposed would meet all of our heating and cooling needs. So it was a significantly large project. So right now we are embarking on a new study to install a 1 megawatt PV, which is
solar.
Solar. So that would carry 3/3 of our electrical needs at this site. So we just started that process. We'll see how it goes.
Who are you working with on that process?
We are working with Tri-State, I believe. They are here today. They're here. Yes.
Excellent, excellent. Yeah, I mean, when you talk about, the geo and looking out at 18 years, I mean, it's important to know, what is viable and what's not. I mean, you've got to make decisions, based on many, many factors, as do, many of you here, who I'm sure that, companies want to explore alternative energy. And, working through the obstacles is an important component of that as well. So, any challenges that you encountered about, new procurement policies to reduce energy consumption? I mean, that was one of them, but anything else you want to?
Yes. So last year when we rolled out the energy policy, we realized, okay, this is not specific. This is more of a mission statement. And so we obviously got pushback on that. What is the policy? What exactly are you asking us to do? So we revamped it, and it's more robust. It's more specific to end users, building operators, new construction. It's the whole gamut: procurement strategies, sustainability practices. I guess for us, it's not much of a challenge because we already have the buy-in from senior management, because we want to reduce our costs. We want to save energy. This is what they want. They're asking us to do. So they are supporting the initiative. But the challenge would be, how do we get this policy to, obviously to get everyone on board, adopt to the policy, and how do we get so specific so that each department their tasks that they're handling daily, that we are handling, that we are addressing their significant issues. I think that's the challenge.
Right.
How do we address the clinical issues? How do we address transportation? It's a number of things because we're such a large organization. So it's going to take a while to roll out the policy and get all the sign